Brooklyn. I'll be your student nurse today. I'm just going to be performing a head-to-toe assessment on you. I'm just going to show this to the camera really quick with nothing on it. Okay, can you tell me your name and date of birth?
Cameron Formsma, February 9th, 2001.
Okay, and do you have any allergies?
No.
And what year is it?
2021.
Who's the president?
Joe Biden.
And what city are we currently in?
Freeland.
Okay, so you're learn-oriented times 3. So I'm just going to start by getting a brief overview of your health. So do you have a history of smoking?
No.
Do you have a history of drinking?
Yeah.
Do you currently drink?
Yeah.
How often?
Every couple weeks.
Okay, and what's your drink of choice?
Just a beer.
Okay. And have you ever been hospitalized overnight?
No.
Have you had any past surgeries?
No.
Are you on any current medications or supplements?
No.
And what do you typically eat in a day?
Just like eggs, fruits and vegetables, and then like meat or seafood.
Okay. And how often do you exercise a week?
Like twice.
Okay. And what kind of exercise is that?
Just walking or running.
Okay, good. So now I'm just going to get some of your vital signs. So I'm going to start with your blood pressure. And are you experiencing any pain today?
No.
Okay. Blood pressure is 122/76. Okay, and I'm going to get your pulse and your respiration rate. Your pulse is 66 and your respirations are 16. So now we're just going to do some range of motion. So can you do this? That's flexion and extension, and like this. Internal and external rotation of the arms, and like this. Abduction and adduction, and then pronation, supination, and then like a swimming motion with your arms. That's circumduction. Okay, good. Now we're gonna do some strength. So can you squeeze my fingers and push against my hands? Pull, push outwards, and push inwards. Okay, good. So I'm just gonna start with your hands and your arms. So I'm gonna check your capillary refill, which is less than 3 seconds on both hands, which is good. And I don't see any clubbing of the fingers. So I'm just gonna look at your arms. Okay, no lesions or scars or anything. Okay, good. That arm looks good too. So I'm just going to check your radial pulse for symmetry. Okay, those are good. Then your brachial pulse. That's symmetric too. Now I'm just going to feel your muscles in your arms. So your muscle tone is good, symmetric. So I'm going to move to your head. So I'm just going to look. It looks symmetrical. I'm going to palpate your scalp. Have you been having any pain, tenderness, anything with your scalp?
No.
Okay, good. And can you go ahead and shrug your shoulders? That's your spinal accessory nerve. And then I'm going to check your facial nerve. So can you smile? Can you frown? Puff out your cheeks and raise your eyebrows. Okay. Now I'm going to put this Q-tip on your face. And you just have to tell me where it's at and keep your eyes closed.
Forehead, left cheek, chin, and right cheek.
Okay, and go ahead and clench your jaw. So I'm just feeling your jaw muscles. So those two things check your trigeminal nerve. Now I'm going to move to your eyes. So go ahead and look up at the ceiling and look down. Okay, so your sclera is nice and white. I'm going to shine this bright light into your eye to check your pupil reactivity. Okay, that's good. And then focus on the tip of the pen line and look at the wall behind me. To the pen line. And then to the wall. Okay, so your pupils are equal, round, react to light, and accommodate to distance. So I'm just going to check a few of your cranial nerves. So just follow the pen line with your eyes without moving your head. So that's checking nerves oculomotor, trochlear, and abducens. So now we're just going to do some cerebellar function. So put your hands in an OK sign, then move your fingers back and forth, and then go as fast as you can. Okay? And then put your hands on your lap, then flip them back and over as fast as you can. Okay? And then put your finger on the pen light into your nose, and then when I move it, don't move your eyes, just move your finger to your nose. Your pen light, then your nose. Okay, good. So now we're going to move to your nose. I have this sign I'm going to put underneath your nose. Just keep your eyes closed, and when you smell it, just let me know what you smell.
Coffee?
Yep. And then go ahead and look in your nose. Okay, mucosa is nice and pink. You don't have any polyps or any abnormal things. I'm going to go ahead and palpate your sinuses. So this is your frontal sinus and your maxillary sinus. Have you had any pain or tenderness with those? Okay, so I'm going to move to your mouth. Can you go ahead and stick out your tongue? Then move it left to right. So that's your hypoglossal nerve. Now I'm just going to take a look inside your mouth. Go ahead, stick out your tongue. And say ah. Okay, good. You don't have any, your tonsils aren't swollen, you don't have any caries or anything in your teeth, so that's good. You can go ahead and swallow. Okay, so checking your uvula in your mouth and then swallowing. Checked your glossopharyngeal nerve and your vagus nerve. So now I'm going to move to your ears. Have you been having any pain or anything with your ears?
No.
Okay, good. So this is your pre-auricular lymph node. your post-auricular lymph node. And I'm just going to move to your neck. So can you take a deep breath? Okay, and then your alignment of your trachea looks good. So you don't use your accessory muscles to breathe, which is good. And then I'm just going to check the rest of your lymph nodes. So this is your occipital lymph node, your submandibular, submental, your cervical chain, and then shrug your shoulders a little bit. This is your supraclavicular, and then I'm going to check your tissue torture. So you're just going to feel a little pinch. And that returns normal, so that's good. And now I'm just going to listen to your carotid arteries with the bell of my stethoscope. I'm just listening for bruits, which we don't want to hear. Okay, those are both good. I'm just gonna feel for your pulse in those two spots. Okay, those are both bounding and symmetrical, so that's good. So I'm just gonna check my sheet to make sure I got everything. Okay. So you can go ahead and turn around in the bed. I'm just gonna assess your lungs. Alright, so I'm just looking at your back. I don't see anything abnormal, so that's good. I'm just gonna palpate for your thyroid. Have you been having any problems with that?
No.
Okay, good. So now, just take a deep breath. Okay, good. So my hands move when you breathe, which is good. And then check your chest wall ratio. So that's 2 to 1, which is good. That means you don't have barrel chest. So now I'm going to percuss your lungs in 6 spots on each lung. So now I'm just going to listen in those same spots. And when I put the stethoscope on you, just take a deep breath. And if you need to take a break, just let me know. Here, one more on each side. Okay, good. Your lung sounds are clear, which means there's nothing wrong with them. And then you can go ahead and lay down in the bed. Okay. And I just need to move the computer so they can see. So I'll just set it down because I have to check your jugular vein distension. So I'm going to just remove the pillow, then turn your head towards the window, then towards me. Okay, good. You don't have jugular vein distension, which is good, but if you were to have that, I would raise the head of the bed up to 45 degrees to see if you still have it then. So now we're just going to look at your chest and listen to your heart sounds. See if you can hold this up. Okay, so I'm just inspecting I don't see anything abnormal, so I'm going to go ahead and listen to your heart sounds. I'll listen with both the diaphragm and the bell. So your first one is on the right, and that's the second intercostal space. And that's your aorta heart sound. Okay, and then the bell. Okay, and then your second one is on the left, and this is your pulmonic heart sound. Okay. And your third one is Erb's point, which is the third intercostal space on the left. Okay. Then your fourth one is called tricuspid. That's the fourth intercostal space on the left. Okay. Then your fifth one is called mitral. So that's the fifth intercostal space about mid-clavicular. Okay, and then I'm just going to listen for a full minute for your apical pulse. Okay, and that was 64. So we're going to move to your abdomen. So I'm going to pull up the sheet and just expose your abdomen. Okay. Okay, and I'm just going to inspect. Okay. Nice and symmetrical, and I don't see any masses or anything. So I'm going to go ahead and listen to your bowel sounds. I'm going to start in your right lower quadrant. Okay, I heard 5. In your right upper quadrant. Okay, heard 5. Left upper quadrant. Okay, 5. And then your left lower quadrant. Okay, good. So I heard 5 vowel sounds in all quadrants. So now I'm just going to listen to your arteries for any breweries. I'm going to start with your aorta. Okay, then to your renal. To your other renal. then to your iliac. And then your other iliac. And then your femoral. Okay. Okay. So no bruise in any of those. Which is good. So now I'm just gonna percuss. So I'm starting the right lower quadrant again. Into the left. And then the left lower. Okay. Then I'm gonna go ahead and percuss to find your liver border. So it's like right here. Now I'm just going to palpate. I'm going to start with light and then move to deep. So in your right lower quadrant, right upper, left upper, and then left lower. Okay, so now I'm just going to do deep, and if you feel any pain or discomfort, just let me know. Then just start in your right lower again. Right upper, right lower, or left upper, sorry, and then left lower. Okay, so everything feels good there. Did you have any pain with those? Okay, so now we're gonna move to your legs. Just gonna move the camera back over. Okay, now I'm just gonna palpate your femoral pulses to make sure they're symmetric. Okay, good. Those are bounding and symmetrical. Okay. So I'm going to check your capillary refill on your toes. Those are both less than 3 seconds, which is good. So I'm just going to feel for your temperature. Which feels like a good temperature. Then I'm going to palpate your pulses. So this is your popliteal pulse. Those are bounding and symmetrical. This is your dorsalis pedis on the top of your foot. And those are bounding and symmetrical. And this is your posterior tibialis pulse. Okay, those are bounding and symmetrical. So I'm just going to check your strength. So can you push against my hands? And then pull. Okay, good. And now I'm going to do this sharp or dull test on you. So this is going to be dull and then sharp. Okay. So just tell me which one you feel and then where at on your legs.
It's dull on my right knee. Dull on my left knee. Sharp on my right shin. Dull on my left shin. Give that one again. Sharp on my right foot. Dull on my left foot. Dull on the bottom of my right foot. And dull on the bottom of my left foot.
Yep. And I'm going to go ahead and check my sheet, make sure I didn't forget anything before we move on. Okay. You can go ahead and sit up in the bed. Okay. Go ahead and just kick your legs out. Okay, that's checking for flexion and extension of your knees. Then go ahead and point your toes downwards. That's plantar flexion, then up. That's dorsal flexion, then just point your toes inwards and outwards. That's inversion and eversion. I'm going to go ahead and check for your patellar reflex. Okay. Okay, that one has a slight reaction. So now I'm just going to put your socks and shoes on before I get you up. Okay, then go ahead and stand up. I'll tie this gown up for you. Okay. Now just make sure your feet are shoulder width apart, and then hands down by your side, and close your eyes. Just hold this for some few seconds. Okay, your Romberg test is negative, which is good. And go ahead and walk to me normally. Okay, good. And walk back heel to toe. Okay, that's good. You can go ahead and take a seat. So I would give you a 23 out of 23 on the Braden scale because you have good nutrition, good physical activity, your sensory perception was good when I tested for that. So you get the perfect score of 23. Then your Romberg test was negative because you had good balance. And then your gait and coordination was good when you walked. So thank you for being my patient.